Welcome everyone. I'm not sure how many of these have happened before, but it's great to be able to meet up on a Friday sunny afternoon from wherever we are based and interact with folks, not just in Liverpool, but I hear that I see that somebody from West Yorkshire as well has joined us today, so that's really good. This is part of the LHP Grand Round Webinar, so a huge welcome and thanks to all the people who have joined us, and also to an early thanks to the presenters for today. We've got an hour to go through, and we've got about 4 presentations to put to you all today. It'll be really useful if during the presentations, if the audience can't put their questions that they would like to ask on the chat box, Professor Hutchin will collect them, and hopefully we'll be able to put all of them through to our panel members towards the end. We're going to be pretty strict with time because of the range of presentations, so hopefully it'll all go smooth. I'm relying on Professor Hutchin, who is who's organized this really wonderfully today. I think we're a bit early to kind of start, but a bit of extra time is a good gift to have. So our first speaker, Professor Gillian Hutchin, I'll let you introduce yourself and get us started.
Okay, thanks, Cecil. So yes, I'm Professor Gillian Hutchin. I worked at Liverpool John Moores University for the past 20+ years, laterally as head of the Institute for Health Research at LGMU. And then in November 2021, I took on this role as head of education and research capacity building at Liverpool Health Partners. And since then, I've been considering the many different aspects around increasing health research capability and capacity by considering the different stages along various researcher pathways that exist within our healthcare system. And that is from people who don't yet understand what research is through to more experienced principal and senior and chief investigators. The research system itself is constantly changing, and that doesn't let us idle. So there'll always be the need to seek further knowledge and development of new skills. Kate or Lindsay, have you got my slide, please?
Yeah, no problem.
Thank you. So I've just got one slide today, and this shows the basic outline of a framework for building capacity. And what I present here will be used to form in future discussion and activity towards the co-development of a final framework and plan of action. And this illustrates the what, how, and who is needed to achieve the aim. The where is across Liverpool Health Partners and the wider system. It's the hospitals, the universities, primary care, community organisations, public health, social care, wherever health research might take place. The overall aim of this ongoing piece of work is to improve the research capability, capacity, inclusivity, and the research culture itself. And to be truly successful and impact on the health of our population, this needs to function across all the different health and social care disciplines and sectors. And to fully achieve our aims, we'll need to gather and use data to inform any activity. So in terms of what we will do and how we will do it, the co-creative process has already started via conversations with representatives of the LHP core team and member organisations. Discussions are ongoing with colleagues in the North West Coast Clinical Research Network, the North West Coast ARC, Innovation Agency, R&D Northwest, for example. So we will work across the system and as a system and avoid duplicity. The next step, starting today, is to engage with researchers themselves, and that's with representation across disciplines, career stages, sectors and organisations. A needs analysis has already identified some of the capacity building priorities and what types of implementations might address these. Liverpool Health Partner Programmes have already been working with researchers to help them form collaborations to write bids, and they've held various training sessions and workshops. And Spark supports researchers to understand governance and to apply for funding. New initiatives will include better signposting to specific resources for researcher development and clearer mapping of possible research career pathways, including, for example, signposting to fellowships. And in the future, we are looking to facilitate some group mentoring schemes, which when they come on board will help to address, for example, particular skill development, fellowship applications, and offer general peer support. So as a researcher myself, I want to ensure that everything we do is grounded in theory and that we use and adapt tried and tested methods rather than trying to rewrite a new research capacity handbook. And it's also important that we are able to evaluate what we do. And that means starting from a known baseline. So we need intelligence on the different researchers that we have within our system, what the current capacity and capability for research is, what is needed now and in the future, and how we can effectively monitor changes over time. And we want to do all this rigorously enough that we can both scale it to other settings and publish our findings in a variety of formats. In terms of dissemination, this is the first of what I hope will be many events and workshops on research capacity building. There's also a new research capacity webpage on the Liverpool Health Partners website just live today that will be a hub for all our activity, resources, signposting. This is very much under development and will grow with time, and feedback and suggestions for content is most welcome and actually actively encouraged. So who will be involved? Well, as a partnership, this work will be taken across the LHP core teams alongside our members and regional stakeholders. And to achieve good solid progress with this, I'd like to form a research capacity building development group that can work on different aspects of the action plan and perhaps meet biannually to report progress. So if anybody's interested in joining this group or would like to be included in an email list for research capacity building around news, information, opportunities, future events, etc., then please let me or the LHP admin team know. I'll put the webpage link and contact details in the chat. Thank you for listening, and I hope you enjoy the rest of today's presentations. Thank you.
Thank you very much, Gillian. Very concise and very good. And just in keeping with the theme for today, which is research capacity building, we have our next speaker, Dr. Emily Clark, who is part of the NIHR Research Scholars Program. So Emily, if you're ready to share your personal.
Thank you very much. I'm just trying to get my slides up. Give me 1 second. I'm Emily Clark. I'm a consultant in sexual health and HIV at the Royal. Can you see my slides, and are they in slideshow?
We can see your slides.
Oh, perfect. That's a good start. So today I'm delighted to talk about the NIHR Research Scholars Programme, and I'm really going to give a personal overview today. So I'll start with just a very brief introduction as to what the RSP, the Research Scholars Programme, is, and then I'll talk about how I've benefited from it. So the RSP is a programme that's run by the North West Coast NIHR CRN, and really the aim is to develop research-interested individuals who are in earlier stages of their clinical research career. So this is offered to those who are in their first 5 years of a substantive consultant post, and also to allied health professionals and nursing staff at any stage of their career. And it's got 3 main goals within this aim. So to develop well-rounded clinicians who will go on to recruit their patients into clinical studies for patient benefit, to support recruitment into the NIHR portfolio, and really to establish future principal and chief investigators going forward. So the structure of the RSP is a 2-year programme, and you have 1 day a week of time for research outputs, and that's half funded by the NIHR, so 1 PA from them, and then another PA is match funded by the trust. And how different scholars were able to take that time varies, but you've got a day's worth of time to do research. And this is then complemented by a day a month of research education. And this is organised and hosted by the NIHR Northwest Coast at their premises in Liverpool. And I'll talk a little bit more about what that involves. And then there was also one-to-one senior clinical research mentorship, where the scholars and the mentors choose each other, basically, and that's provided by senior research active clinicians from across the area. So the monthly education programme was really tailored to the scholars' needs and has two main components. So there's lecture-based teaching, and this is provided by experts in the area to build research knowledge, and really covered everything from how to do a systematic review to qualitative research, right across the board. And then there was also workshop-based learning to build skills. So this is both research skills, such as we had a Dragon's Den to practice pitching, we had a grant writing workshop, but also skills required to lead a research team. So lots of management skills, which you wouldn't necessarily get taught in general as an NHS consultant or clinician. We also had peer support time through active learning sets, but also through just peer discussion, which was really invaluable. And as I said, covered research and management needs. So I was part of the very first cohort. So we started in the spring of 2018, and there were only 6 of us. As a result of the success of the programme, we're now on the 4th cohort, of whom there are 16. So in my cohort, we were all from Liverpool, we were all consultants, but later cohorts have been much more diverse, so containing large numbers for allied health professionals and recruiting really from across the Northwest. And the 4th cohort, which just started at the beginning of this year, also has 4 scholars from Greater Manchester, so really has diversified significantly over time. That's just an overview of the RSP, and I'm going to move on really to how it benefited me personally. Now, just to bear in mind, my experience is just one experience of the programme. We all, or the 6 of us in my cohort, all entered at very different stages. So I don't have a PhD, and I was very new to my consultant job. And so my outputs are in many ways much less impressive than some of my colleagues. One of my colleagues got a £2 million grant throughout the Research Scholars Programme, which is amazing. But I like to think that the progress I showed through the Research Scholars Programme, developed me significantly and has certainly led to massive changes within my department. So I started in May, having become a consultant in the January, and I moved across the country to Liverpool. So I had no local knowledge of the research systems in Liverpool, and I was a brand new consultant. And I joined a department that really had minimal research being conducted in it. And so I identified 5 areas that I would really need to build on through the Research Scholars Programme to upskill my department. So there was a significant need to transform our culture and capability within the Sexual Health Department for research. We needed to start collaborating. There were no collaborations in place at all. We had one portfolio study running, which we were under recruiting to, so I wanted to really increase that. As a kind of longer term goal, I wanted to get a grant, so I'd never held a grant myself. And I also wanted to develop my research career generally. So I'm now nearly 2 years out of the programme. So some of this has been achieved in the programme and some beyond the end. And I'm just going to run through by my aims. So looking at departmental culture and capacity, because I was appointed to the Research Scholars Programme, that gave me enough credibility to ask to be appointed as research lead for my department. And that happened about 3 months after the start of the programme. And that really gave me enough power to start changing things in my department. So the first thing I did was introduce research nurse champions. So these were clinical nurses who were basically given a fancy title. We used to meet regularly, and I gave them support around research. They undertook a project which was presented at conference and got a scholarship for that. And that really started to bring research into the minds of our nursing staff. I introduced quarterly research meetings and chaired a weekly journal club. And as a result of that, we were able to start increasing our research outputs, which I will talk about later. I used my PA from the trust to undertake a weekly research clinic because we were just really not recruiting to trials at all. And then as a result of increasing our research activity, I was able to put together a case to my sexual health management team, and they agreed to appoint a band 7 research nurse to support me. That's developed over time. We've literally just appointed a band 4 research administrator to support our nurse because we're now struggling again with capacity as we've grown. And we also have 2 associate research nurses who are clinical nurses who we release for a morning a week to help us with our research, and that's funded directly from the clinical budget as a recognition of how important research is. We've managed to upskill our nurses, so we've had nurse co-investigators on a couple of trials. All our consultants have had either PI or sub-PI experience, and I've managed to negotiate getting all our nurses and doctors GCP trained. So building research collaborations was a major concern of mine. And I think being a research scholar, again, just having that title and the support and meeting with expert speakers who were from a number of local universities enabled me to really make some local links. So, for example, the Tropical School in Liverpool has a sexual health programme running, but had no links at all with my department, which provides the only sexual health care in Liverpool. So through the programme, I was able to contact one of the clinicians at the Tropical School, and we now co-supervise a number of master's students and have had a joint grant together. And she said to me that actually the only reason she bothered to reply was because I said I'm a research scholar, and she thought that sounds really important, I better get back to this lady. So, you know, it really, the Scholars Programme really helped me build a number of collaborations, both locally and across the country. When I started as a consultant, I was a co-investigator on a number of studies, and then I was able to take over as PI on some studies that were already running. I'd not previously had PI experience, but the PI of those studies felt that with support of the Research Scholars Programme, that would be okay. I took over as PI, and we worked really hard to ensure we were maximising our recruitment, which is something we'd done very poorly as a department before. And then as a consequence of that, we've managed to build our reputation with non-commercial, but also one particular commercial partner who we've undertaken a number of trials for. And this has really developed my PI experience. I managed to get a grant through the NIHR Northwest Coast. So this was end of year funding, and it was only £3,000, but it's the first grant I'd ever held. And it was really the kind of mentoring throughout the programme that gave me the confidence to go for that. I suffer from imposter syndrome significantly, and you know, they really made me go for this grant. And actually, this was really transformative for me, that somebody would give me money to do research. And we undertook some STI research priority setting, which has never been done in the UK before. We undertook this in the Northwest Coast, and this was a programme involving patients, public, clinicians and stakeholders, and was published in STI, which is the highest, has the highest impact factor for any journal in my specialty. And they commissioned an editorial to go with it. And I've just been awarded a £30,000 grant from Beaver to undertake some smoking cessation work in our HIV cohort. So really kind of being able to apply for those grants and the knowledge of how to go for them came directly from the Research Scholars Programme. And I think finally, I just want to talk about how the Research Scholars Programme gave me the confidence to go for additional roles. And this was partly as a result of peer support, partly due to the mentoring. But I think, you know, as a new consultant, you often feel like you're trying to kind of keep up with your colleagues, there's lots to learn. But actually the peer support was the first time I'd experienced kind of peer advice where I really felt that no one had any other agenda other than to help me personally develop, which gave me significant confidence. So, you know, I was able to ask for the research lead in my department, but then as a consequence of the skills I developed, I also went for the British Association for Sexual Health and HIV chair of the Clinical Standards Group, which I'm you know, delighted to have held for the last 2 years. I applied to become a topic expert on a NICE committee, which also further developed my skills. And then following the Research Scholars Programme, I've been appointed as the clinical lead for HIV. I've become the Associate Clinical Director of the ongoing programme, which means that I can support future cohorts and help deliver and plan the programme. and I've literally just been made co-deputy clinical director of research at Luft. And again, you know, the feedback I got was this was directly as a result of what I'd learned and gained through the Research Scholars Programme. So, you know, in conclusion, I would say the RSP has been completely transformative for me. It's really transformed my research career, but I think beyond that, it's made, you know, it's turned me from a brand new consultant into somebody who's sufficiently confident beyond my clinical knowledge to be able to take on senior clinical lead roles. And, you know, it's transformed my career, and I can't recommend the programme enough. Thank you very much.
Thank you, Emily. It's brilliant to hear your journey. And I can't kind of proceed further without saying congratulations. And you know, you've achieved tremendous things. So really, really huge congratulations on that. We're going to be taking some questions, Emily, but we'll probably just keep that on for later on. But lovely to hear that on a glorious Friday afternoon. That takes us really nicely to our next speakers, Dr. George and Dr. Catherine. I've known George a long time ago, and I'd seen him or very differently. And then it's gone 2 years, and he's almost morphed into Osho Rajneesh type guru. But George, here you are. You've got the next 10 minutes to talk about the wonderful ARC internships.
Thanks, Cecil. When I stop laughing. So hopefully I can go into a slideshow mode here rather than you seeing all the slides. Give me a second. Here we go. So thank you for inviting us today, Gillian, and thanks, Cecil, for your introduction. So we're here to talk to you about the ARC Northwest Coast internship. So that will be my role. And then my colleague, Catherine, will talk about the mental health capacity building work that we've been tasked to do by the NIHR. So I wasn't aware of what the audience was going to be like today for this presentation. So I thought I'd give you a bit of a background as to what the ARC is. So we're the Applied Research Collaboration Northwest Coast. We're funded by the National Institute for Health Research. We previously existed as something called the CLARC, the Collaboration for Leadership in Applied Health Research and Care. The NIHR wisely thought that perhaps they should shorten that to something a bit more snappy. So we became an ARC in November 2019, which we had a lovely launch event in Blackpool. And then 3 or 4 months later, we all went to working from home. So no apologies here. I've stolen this from our website. We're a collaboration that currently involves 5 universities across the Northwest Coast. So Liverpool University, Liverpool John Moores, Edge Hill, Lancaster, and University of Central Lancashire UCLan in Preston. And our role is to engage and involve organisations involved in delivering health and social care, and those being primary, secondary, tertiary care, public health, and third sector organisations. And we call the organisations that work with us members. And currently there are over 60 members across the Northwest Coast that are part of the ARC. We are passionate about involving the public in all our projects, from the idea generation through to the implementation of a project. What we are about, at least in the impact team, is developing members' research and implementation capacities and skills. We are aware, and one of my colleagues does a fantastic presentation where he shows that delay between evidence being published and evidence being implemented could be something as long as 16 years. Now imagine how quickly the world's moving. 16 years, if you've come up with something that's innovative, may not even apply in 2 years' time, let alone 16 years' time. So we're about shortening that delay between the research need being identified and the findings being implemented. We are about the broader economic gains that could be realised across the Northwest Coast through the research investment. We are supportive of developing bids for funding to bring in research income into the Northwest Coast. And we are tasked with collaborating with the other ARCs, and there's 15 of them now, I believe, across England. And what we call the NIHR infrastructure, that would be the biomedical research centres, the patient safety translational research centres, the schools for public health, etc. We're tasked with working with them collaboratively, and the innovation agencies, so the AHSNs, the academic health science networks, and the Research Design Service. So we're tasked with working collaboratively with all those organisations to try and address any sort of regional and national priorities. We have themes. We have research themes, these being person-centred complex care, which is led by Prof. Tony Marson, improving population health, which is led by Prof. Ben Barr, equitable place-based health and care, that's led by Prof. Catherine Morse at Lancaster University, health and care across the life course, that's Prof. Mark Gabbay's theme. But we also have cross-cutting themes, such as care and health informatics, led by Professor Sarah Rogers, the MIDAS group, which is led by Prof. Andy Clegg at UCLan, and obviously implementation and capacity building team, which is where Catherine and I sit, which is led by Professor Dame Caroline Watkins at UCLan. So we do spread across all the ARC universities to provide the support for the projects that we support. When it comes to internships, we offered these throughout the lifetime of the clerk. And I think we were close to 70 interns over the 5 years of the clerk. So we've carried on with offering programs, internship programs, but there are certain stipulations that would make you suitable to apply for one. One has to be that you are employed by one of the organisations that's an North West Coast member. Our NIHR contract doesn't allow us to offer them to other people employed by other organisations, unfortunately. You should align to one of the national and local priorities. So we always ask our interns when they're applying for something, is this a priority for you, for your organisation, for your service users, for your patients? We have something called the Health Inequalities Assessment Toolkit. As we know, within the North West Coast, there is a huge difference between the inequalities that exist here and, say, other parts of the country. And when we think of areas like Blackpool and Liverpool, and certain areas of East Lancashire, certain areas of South Cumbria, there are huge inequalities that exist in the communities there, and their ability to access the services that they need. We insist that every project has something called a public advisor. So you'll be used to the term of patient and public involvement, but we call them public advisors. Because obviously, if you're working in a project that involves a community, for instance, you're not a patient in that community, you're a member of the public. So we use that term. And every project, we seek to improve socio-economic health inequalities. So by using the HIAT that I described earlier, that helps you identify what health inequality may exist. And it also asks you, well, how would you address this? How would you make things better? How would you, instead of increasing that gap, actually lessen that gap, lessen that inequality? Or is it what it is that you're trying to change? Could that actually introduce an inequality? As regards the internships that we've offered over the years, and we're continuing to offer within the ARC, we have something called Rapid Conversion Evidence Summaries internships. We've offered these twice now so far. We ask people to come to us with an idea around an existing systematic review. So something that has been published, there's an evidence base there, and it's something that they wish to address or change within their organisation, within their service, for instance. And currently we have 5 interns going through that scheme, 3 of which are actually doctors as well. And once they've done their evidence summary, we support them to publish that. And then we also support them to develop something called an implementation plan. So how would you enact what you've researched? How would you take that evidence and actually apply it to the area that you work in? And what would you need to do to be able to implement it effectively? We support fellowship developments at the pre-doctoral, doctoral and advanced fellowship level for an IHR. Something that's new over the past couple of years in the ARC, we've offered what we call data science internships. So for organisations that have access to big data and they wish to investigate that data to look at whether or not there's a research question that could be answered by using that data, or it could inform a big funding application, for instance, or a service development, we've been supporting interns to do that. All the way from interns looking at data that they're routinely collecting clinically to see how they can improve their service, to one intern who actually wants to do modelling to see how they could use that to inform where the service need might be. And we also offer internships in something called implementation, which I've mentioned before, and research. And we're currently offering them at the moment. Interns have come to us, or applicants have come to us with project ideas, and we're helping support them develop them into full-scale research projects. We provide a program of training for these internships as well. I'm going to hand over to my colleague Catherine now, who will talk to you about the mental health capacity building that we're doing. And Catherine, I believe you want to share the slides rather than me moving them forward. Is that right?
Yes, please. Yeah.
Right. So let me try and on-share. Yes. There we go. Okay, it's all yours.
Thank you. Right, lovely. Yes, thank you, George. So I want to talk in a little bit more detail about the mental health research capacity building, which is something that we've recently received funding for. So to give a brief background, obviously, you know, as we all know, high levels of mental health problems are linked to socioeconomic disadvantage, and the NIHR made available £750,000 to ARCs that have this high level of disadvantage, but didn't have, you know, particularly numerous mental health research projects. So North West Coast successfully applied for this funding and received it earlier this year. So the overall aim of it is to build capacity in mental health research and implementation and evaluation, and you know, in both health and social care workforce, as well as area early career academic researchers. So the way that we are administering this funding is through something called an impact roundtable, and this is something that has already been developed in the impact team at UCLan. So they have a current roundtable, for example, looking at stroke care. So we've set up a mental health roundtable, and what this does is brings together a strategic level group of individuals who've got expertise in a particular topic of interest. So with this, it's mental health. And it provides a forum through which knowledge can be shared across these stakeholders in order to understand what's happening across North West Coast in mental health research, to shape future research and implementation by identifying gaps, you know, what's not happening, and reduce duplication of effort and increase collaboration, and hopefully generate learning of implementing change across the system. The people that we have invited to participate in our mental health roundtable come from these 6 different sectors. So we've got representatives from health and social care organisations. And in fact, we have, instead of having one chair for the roundtable, we have co-chairs. And one of them is Ian Crabtree, who's the Director of Adult Services for Lancashire County Council. And the other one is Taj Nathan, who's a forensic clinical psychiatrist. So we've got those 2 perspectives, you know, kind of directing the roundtable. So we've got representatives from local authorities, local universities, the wider NIHR infrastructure, third sector organisations, and of course, members of the public. And the objectives of the roundtable, you know, in terms of using this funding, are to establish priority areas of need, to identify promising proposals for research and innovation or implementation of evidence in these priority areas. The research must be co-produced with a focus on equity, and we want to identify research champions in the health and social care workforce to develop through our research internships. And this is all very collaborative in nature. So we collaborate with mental health service providers, integrated care systems, higher education institutions, our ARC member organisations, and the other ARCs across Northern England in particular, but also nationally as well. And the overall aim is to attract inward research grant investment into the North West Coast. So I just want to give a little bit more detail about our workforce research internships, and these have been termed knowledge transfer internships. And this is where a staff member from a service applies with a research idea that they want to explore. They will be interviewed to decide whether their idea meets the roundtable objectives, and if successful, they're given day release for 1 year, an academic supervisor, so that would be an academic from one of our partner higher education institutions who's got expertise in that particular area to support them, and access to relevant research training. And over that year, they would carry out a research project and present their findings, probably in the form of a short report or a poster. So, as I say, we set up the table in February. We had our first meeting in February, and we've got another one in May. And our current activity is mapping mental health academic interests across the Northwest. And we're very shortly going to be distributing a short survey to people to tell us about their academic interests and experiences. And then we're seeking mental health service research priorities from our ARC member organisations. So please do look out for emails containing those surveys, because we want to hear from as many people as possible. And once we've done that, our next step will be to advertise these internships. So again, please look out for the publicity surrounding that, and share with anybody that you think would be interested. So that's all I want to say. This is our email address if anybody wants to get in touch with us directly. And thank you very much for your time today.
Thank you, Catherine. Thanks, George, for that presentation. Lovely. We're just kind of overrunning a little bit, but it's wonderful to kind of hear our next speaker, Karen.
Hi there. Just share my slides. Great, so thanks so much for inviting me to talk today. I'll be talking about the Hugh Greenwood Legacy Funding. So my name is Karen Martin. I'm a Clinical Research Fellow at the University of Liverpool, and also a Community Child Health Trainee in my ST7 year. So my supervisors are Professor Melissa Gladstone and Dr. Mortan, and they were awarded the Hugh Greenwood Legacy Funding. So what I'll do is I'll just talk briefly about the funding, tell you a little bit about the research that we're doing, and then just talk a bit about how this funding has been able to build some research capacity. So the Hugh Greenwood Legacy for Children's Health Research is a philanthropic fund, and it exists to support children's health research that will directly improve the lives of children looked after by Alder Hey Children's Hospital. So underpinning everything needs to be having children's and young people's health outcomes at the centre, and it also needs to underpin the Liverpool Health Partners Starting Well programme and work in close collaboration with the University of Liverpool. So a little bit about the research that we're doing. So we're focusing on early identification of infants at high risk of cerebral palsy in Liverpool. So clinical tools exist which can allow CP to be diagnosed at a much earlier age now, around, well, 3 to 6 months of age. We can have a diagnosis of CP or high risk of CP. So this is through clinical examinations such as the Hammersmith Infant Neurological Exam, an observation of spontaneous movements of the infant called the General Movements Assessment, and also neuroimaging, just MRI. So relatively simple tools. And this is able to bring down the diagnosis of CP to less than 6 months from historically being more 12 to 24 months. So obviously the benefits of early identification mean early intervention can happen in that really important period of early brain plasticity. And this allows us to optimize motor and cognitive learning, prevent secondary complications, and enable earlier family support, which is really important. So although we're very clear about the evidence for these tools, unfortunately the tools aren't very widespread at the moment. And there's a few centres in the UK that are using them, and a few centres around the world, but it isn't a widespread common practice, and it doesn't appear in the guidance with any sort of major force. So the work that we're doing is really around implementation of these tools. So it comes under the umbrella of implementation science. So this really is looking at, I suppose this diagram here can help explain implementation science. So it's trying to study this gap here, which is looking at trying to bridge the gap between what we know from research papers and journals into actually what we practice on the ground. And as was mentioned earlier, this can be up to 16 or 17 years. You can imagine the number of children with brain injury that could have been helped during that time. So our work is trying to understand how best can we bring these early identification tools into practice. So in order to answer that question, we need to think about the people who will be actually providing the implementation, the innovation. So the professionals, neonatologists, allied health professionals, physiotherapists, developmental paediatricians. We also need to think about the context, so the organisational context and wider context, and also those who are obviously receiving the intervention, the families and patients. So the work that I've mainly been concentrating on is a qualitative study looking at the professional views on the barriers and facilitators to implementation of these tools. So I've undertaken in-depth interviews with various professionals over the Liverpool Women's and Alder Hey Children's Hospital sites, and also focus groups as well, just trying to identify those barriers so that we can understand how best to mitigate them and provide as best implementation as possible. Alice Fortune, who is a MPhil student and medical student at the University of Liverpool, has also looked at another arm of the study, which is looking at parent experiences of early neurodevelopmental follow-up, and she's come up with various recommendations in order to decrease uncertainty in that early journey. Okay, so I'll talk a little bit more now about how we've been able to build research capacity with this funding. So at a personal level, it's helped me hugely. I'm a community child health trainee. It's really not the norm for a community child health trainee to undertake any major research. And amongst my colleagues, I think I'm the only one that I know of personally. So hopefully it'll encourage some others to take some of the same steps. Yeah, I mean, I've gained a huge amount. I'm doing an MPhil at the University of Liverpool, and I've undertaken training in qualitative and research methods, and also in implementation science, which, to be honest, I'd never even heard of before I started this, this programme. And I think I can take all of these skills forward with me into my future career. You know, even just day-to-day conversations in the clinical environment, research will be much more at the forefront of my mind. I think it'll change my patient care as well. And in terms of future goals, I'd love to seek out a post, a more academic post. Maybe I can be a research lead as a consultant, or even thinking about clinical lecturer posts. In terms of local capacity, I think this funding has allowed various health professionals locally to become more involved in research. Reshma Soule is a senior paediatric physiotherapist at Alder Hey Children's Hospital, and has recently started to do a new training in early careers in research, which is with the NIHR. And she's been mentored by Professor Gladstone, who was awarded this grant. And she's able to meet with us around once a week and building up her research skills. So with me, we meet and we go through coding of the qualitative research that we're doing. So she's getting practical skills, and she's soon going to move on to systematic reviews. Dr. Mortan, who was co-awarded this funding, also my supervisor, she is a neurodevelopmental paediatrician at Alder Hey Hospital, and has previously had some research experience in intervention studies, but is now much more confident in qualitative methods, and would seek funding in this area to do similar studies in the future. And I've mentioned Alice Fortune, who was able to do this parental experience study as well. I think this funding has helped make connections both locally and further afield. Through the nature of this study, it's provided brilliant opportunities to build relationships between Alder Hey and Liverpool Women's Hospital. Through focus groups as part of the study, we've been able to bring professionals together from both sites in conversations about how to bring evidence into practice and within our joint care systems. and also to raise awareness about implementation research amongst clinicians, which I don't think is really well known. Through attending training on implementation science, we've also made connections in that field who can help us to navigate that new field as well, which can be quite a confusing field. And we've made contacts at Newcastle University, Great Ormond Street Hospital, with researchers in early identification, and hoping to collaborate with them on a national survey of high-risk follow-up. And then a bit further afield, Anderson Magogo is a physiotherapist and researcher in Malawi, who is also doing research on early identification and its implementation. And we'll be visiting our team shortly in a few months. And I think we can really learn a lot from each other from trying to implement this in different settings. And then in terms of next steps, we're in the process of writing a grant for NIHR research for patient benefit for the next step, which is to hopefully trial an early intervention for those infants who have been identified early. So that's it. Thank you very much. We're on to questions now.
Thank you, Karen. It's wonderful. It's been a great session of kind of just hearing wonderful stories of personal experiences, and also kind of coming to know about different structures that's available locally. And that's kind of, I think, in many ways has served today's purpose, which is about connecting, hearing good things, and kind of inquiring about what are the possibilities in breaking the mold in many ways. Professor Hutchin, you've been helping me collect the questions for our panel's members.
I have. We've got time for some questions. So first question to Emily was a question around, do you think that there's the possibility of extracting elements from the Research Scholars Programme, perhaps in a more compact version for colleagues who want to be involved in research, but not necessarily as a research lead?
Yeah, I think definitely. I mean, you know, actually a lot of it could be delivered as standalone. So some of the workshops, for example, in grant writing could easily be standalone. I do think, certainly for me personally, I'm not even sure it was so much what I learned, but more that whole kind of package of mentoring and support around me really gave me the confidence to go for things that I just wouldn't have dared go for without it. So although I think you could certainly take out the knowledge and skills, I do think there's a lot to be said for having somebody who you respect in a senior research position saying you have to go for that, and then, you know, you've told them about it, you've got to go for it, and it's amazing what you get when you do go for it. So yes, in some ways.
And that actually leads into another question from Mark for you, is that do you yourself, have you gone on to mentor other applicants on the Research Scholars Programme, just to share what you've learned through that process? So
because I'm one of the associate clinical directors, I'm actually, every time they have an educational day, I'm there with them. So because of that role, I've decided not to directly mentor any of them, but many of our other previous Research Scholars Programme graduates do act as mentors along with other people. I just didn't want to have any kind of conflict around that.
Yeah, that's great. I think that's also something that within this capacity building at Liverpool Health Partners around some of those, the mentoring programme we're looking to pull together might be around getting a group of researchers who want to apply for the scheme and get them, you know, bring in some support from previous research scholars to help them there.
I think it's also just helpful to have kind of people who've done different things. You know, sometimes you look at, everyone seems to have a PhD and be very, very academic. And actually, if you're not in that situation, it's nice to see people who've come through different routes, and that's really helpful.
Okay, thanks. A question for Catherine around the mental health programme, asking if students from the universities can get involved with the roundtable.
Yeah, thanks for the question. We've had a lot of interest in people wanting to join the roundtable. So unfortunately, it's got to be a limited number. Otherwise, it would become, you know, it would become sort of unmanageable, really. So we're not we're not inviting any new people to join the roundtable at the moment, but we hope that we'll have other activities, consultations, things like that people can join in with. So, hopefully they can look out for those kinds of opportunities and join in that way. Okay.
That's great, thanks. And I think just to pull together some other questions that have been asked around, this is perhaps open to everybody, about involving members of public in your schemes and developing partnerships with community organisations around the evaluation of your work and introducing them and providing research opportunities that encompass public and communities. I know that's key to what the ARC does. If anybody has any comments on this?
I think if it's an organisation that's linked with one of the ARC member organisations, that could be the way they route through to linking in with the expertise that could be available via the ARC. And they could come to us with a project idea. We do not provide funding. We provide support. We have to be clear about that. And Jane's on this call as well. Jane Cloak is our programme director for the ARC. I don't know if Jane wants to chip in with anything or whether or not you just want to put it in the chat, Jane. But there are routes into working with the ARC. If you're not an ARC member, there could be a way through if you're linked with, for instance, Liverpool City Council or some other way.
So, yeah, thanks, George, for bringing me in, if I may. We did do a thing under Clark called the Partners Priority Programme, which was a series of workshops to help teams co-develop an evaluation. And I think there are some people on this call that were involved in that. I think we're planning to do something similar as part of the mental health capacity building thing. But and I've also just put in the chat a link to that program. I mean, it's something that we could think of doing again, but as George says, we haven't necessarily got budget to do it. But if there's enough interest and between us we can gather enough resources to deliver, I mean, that could be something we might want to support.
Thanks, Jane. I've seen a couple of hands there, Gillian. Maybe we just got a minute to kind of just field a couple of comments, and then we'll probably have to go get to closing. Is that all right, Gillian? Pam, did you?
Yeah, that's fine. Yeah, that's fine, Cecil.
Yeah, it's just that I've been working with a lot of community organisations over the last 6 months, and some of the work that they're doing, that they're evaluating for funding, it is really quite incredible in terms of well-being and employment and lots of other social determinants that actually would feed into health inequalities. And I just wonder whether there's an opportunity with the Marmot Community Policy Directive to actually think about how we can use these evaluations that they do on almost a weekly basis to get their funding, how we as academics could actually support them more and develop that capacity for research in the community.
Thank you, Pam. That's a good point. Jade?
I'm actually wanting to answer Pam's question there. Absolutely, Pam. I'm working a lot in the community and with local charities like the Brain Charity and Everton in the Community. Everton in the Community are opening the People's Place, which is a hub for mental health support for the Cheshire Merseyside population. And yes, we want to find funding streams where we can look at interventions or evaluation of support that's being provided in the community. And of course, the NIHR Public Health Research Programme is indeed about doing that research and that evaluation in a non-NHS setting. So for activity that is happening in the community, that is one possible funding stream. We could have an offline chat, Pam, and I could find out more about what you're doing. And I've got a number of teams and special interest groups as part of the LHP Neuroscience and Mental Health Programme that provide excellent peer support and collaboration. specifically for these kinds of activities.
Thank you, Jade. Thanks for picking that up. And I think that will lead on to some wonderful conversations. I certainly hope so. Again, a big thank you to everyone who joined us today. A big thank you to all the presenters today for giving up their time, telling us their experiences, sharing with us their views. Just a quick reminder that we've recorded this session, so hopefully that should be available to people to view later on equally. There is going to be a link to evaluating the grand round, so please, a big request for people to feedback, because that's one way we can improve these sessions. And also that if anyone in the audience is interested in engaging with the future research capacity building activities, I hope I can point them towards Professor Hutchin. I think the next event is going to take place in summer 2022 by the Spark team. Professor Hutchin, is there anything you would like to add?